You're watching Heart to Heart on ABC 27. Brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. A Cumberland County man thought he had a bad cold. It turned out his heart was in bad shape. His family had to make some pretty big decisions to save his life.
3 days later, I then woke up. When I woke up, I had a tube down my throat, just was trying to figure out what happened. Went back to sleep, and then I'd say probably another day later, I woke up again. My wife, she started to talk to me. She said, Jason, she says, you got a bad heart. You're going to be in for a long haul, to see what's going to happen in time to come.
He didn't know how bad he was. He didn't know how we almost lost him.
One day, the doctors came in, they gathered around the bed, and they were talking with me, and then they finally said, Jason, they said, your heart's not good. And they said, we really feel you need a heart transplant.
Initially, a heart transplant was in Jason's future, but his heart became stronger.
Since his heart seemed to recover faster than expected, he did not need other means of mechanical circulatory support like a left ventricular assist device, which is an external pump, or undergo evaluation for a heart transplant.
The news kept getting better. After 14 days, doctors removed the ECMO device from Jason.
It's amazing because when they took him off the machine, how his heart really was stronger. It was so obvious how his heart was just showing that it had improvement because it was at rest for 2 weeks.
Finally, they came to me and they said, Jason, they said, we think we're just going to put a defibrillator pacemaker in you and just send you home, keep an eye on you and see, where we go from here.
I was like, I'm game. I don't want to be gotten up at 3:15 again to this nightmare.
The implantable defibrillator is like a pacemaker. It's a computer that is not too big, and it gets implanted underneath the collarbone with a lead, which is basically a cable that attaches inside to the heart muscle. And this lead has electrodes that can sense the electrical activity of the heart. So if the heart is to develop a fast abnormal rhythm, the computer will realize that and identify it as a life-threatening rhythm and then deliver an electrical shock. It has a big enough battery that could generate enough energy to reset the heart and then restore the normal heart rhythm.
The doctors, they came in and they said, you're going to be able to go home a couple days after you have the defibrillator and pacemaker put in. At that point in time, hearing the word home, going from, needing a heart transplant to now going home, that was the greatest news in the world at that point in time.
After spending 3 weeks in the hospital, Jason did go home. Family and friends gave him the emotional and the financial support that he needed. Pray for Jason wristbands were sold. A benefit concert was held.
I would not be where I'm at today if it wouldn't be for the love and support from family and friends.
It took some time, but gradually Jason gained more strength. He recovered.
Today I feel great. I still have a hard time believing that I went through what I went through because I feel so good.
I can't believe how well he's doing. He's better. I mean, he's better than he was before. Really, I truly believe that.
I am so thankful to have a second chance, that I can spend more time with my wife, see my kids grow up, just to be a part of their lives another day. It means the world to me. It makes you stop and think about and reprioritize things a little bit in your life, what's important and what isn't.
And Jason said this incident certainly brought his family much closer. He said his family is now his priority. Jason is on heart-related medications, and he sees doctors every 6 months. Chuck?
Thank you, Deborah. Now joining us on the desk is Dr. John Bamer, the Program Director of Heart Failure Department. Now, we talked during the break and before the show. Is this considered heart failure, what happened to Jason?
Yes, it is. And heart failure actually is more of a clinical syndrome than it is one specific heart condition. So many heart conditions, when they become abnormal enough, can lead to heart failure. And heart failure simply means that the heart doesn't pump enough blood, or in order to pump enough blood, it has to do it under abnormal conditions, like the heart has to fill at higher pressures. And that can cause symptoms and certain findings doctors can see. So it's that constellation of symptoms people have and findings doctors can see that we call heart failure.
Is it dangerous?
Well, any heart diagnosis is worrisome. And certainly heart failure is a worrisome diagnosis. And people can have trouble, can be limited, and people can die from heart failure. But the good news is that we have ways to treat and control it, much like with Jason, so that people can feel well and live long, productive lives, even though they have such a diagnosis.
How common is heart failure today in the country?
Heart failure is a very common disease. Nearly 6 million Americans have heart failure right now. And it's the #1 reason for somebody in the Medicare age group to be hospitalized. So it's very common, and it leads to a lot of symptoms and a lot of times to hospitalizations.
Talk about the research and maybe some of the new options available for someone with heart failure.
Well, as I mentioned, the good news is we have ways of treating heart disease, and much of it has to do with medical therapy. We have good medicines to use to treat patients, and over the last 20 to 30 years, we've developed a number of medicines that have miraculously changed the heart failure condition to one where if you had advanced heart failure, we would expect you to die within a year or so, to the point where people can live many years and not only survive, but live better. So we've made great advances with that. But in terms of the new treatments that we have, like the defibrillators, it's only been in the last decade that we've used those before somebody has a bad rhythm disturbance, prophylactically. So we're using those more commonly. We now have mechanical blood pumps. Now, Jason had a blood pump that was used temporarily, but we actually have pumps we can put inside people that they can go out and you can walk past somebody in the grocery store and not realize that they have a mechanical blood pump that's serving the function of their heart. And finally, we're working on ways of diagnosing heart failure before people end up in the hospital to be able to monitor them.
Making all kinds of progress, Doctor. Thank you for joining us here tonight. Let's go back into the call center with Deborah Pinkerton.
Thanks, Chuck. We have time for another viewer question. Dr. Kozak is here with us. My maternal and paternal grandfathers each developed advanced heart disease in their 50s. I'm only in my 20s, but I'd like to know when I should get tested for heart problems.
Well, you know, I think it's much more important to start preventing heart disease in your 20s than to worry about getting tested. And I think that the questioner should make sure that he's following a good diet and is getting regular exercise. And also he should have his cholesterol, glucose, and blood pressure measured and treated if they're elevated.
And that's something that we all should really do.
And I think that's a great point, that we should all be doing those kind of things to prevent heart disease later in life.
Okay, thanks so much, Dr. Kozak. And when we come back, we will talk to a doctor from the Med Center who almost lost his life from a serious heart problem. Stay with us. We'll be right back.